Hi everyone, so in this video I'm going to talk about adenoids and tonsils. So my 6-year-old, she snores at night and I took a ENT appointment for her, and the doctor said that she needs to have the adenoids surgery. And before getting a surgery done, I wanted to look for more options. I wanted to know more what we can do without surgery. So in this video I'm going to share what all I'm doing. So it is like the extra things I'm doing before surgery to just avoid the surgery if it can be done, like if it can be avoided. So the first thing I did, I took her to the dentist. So the dentist where we go is our family dentist, and they are really good. So the doctor said like she is small to get the expanders in her mouth, and they do not specialize in the sleep apnea with the kids or with the snoring problem. So he said that you need to take you can take a different opinion if you want. So I think I did some research. There is something called airways orthodontics, and I think they specialized with the sleep, like with the snoring and with the sleep apnea. So you can Google and you can look for airways orthodontics or the dentist who actually specialize with kids with the snoring problem. So our dentist said he has not done this before with a child, and my child is only 6. So he said like she's small, so maybe you can get the surgery done, or maybe you can look for a second opinion. So if you are if you want to take an opinion from your dentist, take your child to dentist or maybe to the person who specializes with this, because I think the older kids can get expander or something after the scan. Like the dentist do a scan of their mouth, and if they decide, I think there's something called expanders. I think they can do for that for your child. But for my child, I think she was small, so he said no. So at least I got to have an opinion from the dentist after the scan, and the dentist said that her mouth is growing fine, her teeth and her jaws, everything is fine, there is nothing to worry about. So at least I was happy that I got the scan done. So maybe you can go to a dentist and get a scan done and ask and talk to your dentist. Second was the allergist. So before as I mentioned that before getting the surgery done, I want to try all my options. So I went to the allergist. So the allergy doctor said he can do the test, and he can check for the allergies. So he did like 42 liquid drop. I think in the allergy test they put like 42 drops of liquid behind at the back, and they wait for 20 minutes, and I think there are 13 injections. They give you like 13 injections, and that's how they do like the allergy testing with the injection and with that dot. So after the test results were like she was allergic to trees, house plants and dogs and cats. So we have dogs at home, we have no cats. And so he said like you need to clean your daughter rooms entire, like your daughter's room should be clean entirely. No, like no soft toys, no like no dogs. So maybe I'll be changing the mattress, and I'll be doing like full cleanup for my daughter's room. And with the dogs are not allowed in her room anymore. She plays with dogs, but like dogs right there, she's sleeping, I think. So so we are going to clean her room, and we are using filter, the air filter, so that the air of the room is clean. So we are going to use the air purifier, and humidifier I use every night. So at least if you are planning, like if your doctor has said, your ENT has said for the surgery, these are the things you can plan. Or you can go to the allergist and dentist and ask for, maybe you can avoid surgery. But if surgery cannot be avoided, then it has to be done, I guess. So we are doing humidifier, we are doing the air purifier, and in the night I give her this spray. This is over the counter, and I give her this spray in the night, just one puff here and one here, and she sleeps okay. And I think it really helps with snoring. She is not snoring very loud as I'm giving her the spray. In the morning, if I feel that she has little runny nose or like congestion, I might just clean up with this. So you can do like cleaning of nose in the morning and the spray. And the allergist has came with a plan. So the plan for 2 weeks is just to clean her room, keep her away from the dogs. She cannot sleep with dogs cannot be the room, and I'm going to take all the house plants out. It's harsh winter right now here, and it's like 20 Fahrenheit, so I cannot throw away all the house plants. So maybe I'll just donate them to somebody. So the plants, so maybe getting the allergy testing done for your child will be good. So we got the dentist, we got the allergist, we got we got to know the allergy thing. And yeah, the allergist said that after 2 weeks I have to tell him how she's doing after 2-3 weeks, and then he's going to decide whether whether she needs, like whether the doctor needs to go on plan B. So he said that there are some medicine, there are some things which he can prescribe, but that's the plan B. First we need to do with the dogs, we need to take out the plants, need to clean up the room and everything, and need to see how she's sleeping in the night. So for 2 weeks I'm going to focus on that. And the third thing which I learned, that there are some homeopathic medicines, there are some homeopathic doctors which are in India, I think, because in India I think they practice homeopathic medicine, and there are other parts of the country as well. So if you want, you can try a homeopathic doctor, and you can talk to them, you can share the x-ray or any report which you have with them if you want to avoid surgery. But again, it is totally your personal choice, your personal way of thinking, how you want to do it. This is something which I'm sharing as a mother, because our surgery is next month at the end, next month in the very end. So I think it's March 30th. So we are just trying to maintain, we are just trying to make sure that what all we can help her with. So you can try for the homeopathic medicine, you can try an online homeopathic doctor, because I don't know about US, how it works in US. I do know that in India there are many homeopathic doctors. So this is totally optional, because I don't know online, whether you'll find somebody good or not, or maybe because I just feel I don't know, with online thing I'm little like, I don't know, I am not seeing the doctor. So with online consultation I'm little I get nervous, so I don't do the online consultation. I want to see the doctor in person, especially for my child. So I did not do any homeopathic medicine. But in case if I feel that I have to do it, if I can find something which is in person, I would share that. But of course you can try that, but again, it's totally your call. It's something which you need to decide. And right now what I am doing before surgery, like things which I'm trying to be practical with. So I avoid swimming. If she sometimes go to swimming where I go in our club, like on Sunday. So I do the earplugs, and I make sure that all the hair is dry when she's before like bed, because we come late in the night, like by 7 after the club. So I make sure when she's going to bed, her hair is dry. So I take a hair dryer and just make sure that hair is dry. I do not do the morning shower for my kid, only when they come from school, because in the morning the temperature is very, very like harsh, it's very cold. So I do avoid morning showers, which I already explained in my last video. I explained a lot of things what all I'm doing. So this is something which I'm sharing. If you are thinking that before surgery you want to try something, so a dentist, airways, orthodontics, and there is I think I don't know, I think the chiropractor or something, like they also do some therapies with the tongue. I think they teach you exercising and something that also I figured it out on Google. It says like many people make you practice with the tongue or something. That I have no idea with. I did not try. I just went to the allergist, and I just went to the dentist. So those things I know that it can work for your child. Maybe the medicine, maybe keeping allergies out of your house, maybe that can help your child and you can avoid the surgery. But again, this is just my trial kind of period, I can say. I'm just trying all good things for my child, maybe thinking like she does not have to go through surgery. but by the end of March I feel that um, these things are not working, these things are failing, like, you know, the spray and the other whatever things I'm doing. I might just take her to the adenoids surgery, like the removal of adenoids and tonsil. So in this video I was just sharing what all I'm doing. Maybe, like, you know, and yes, and the night, do not give dairy to your child. So I don't do dairy or I don't do milk at night. And yeah, and in the ears I do garlic oil. Sometimes weekly I put 2 drops of garlic oil and I massage the ears. I also do oiling of my kids hair because they are girls, and oiling really helps them to keep that moisture away. So these things I'm doing. Also sometimes or maybe daily, I try to sleep with my child just to keep an like, just to, you know, make sure that, you know, I'm sleeping with her. So in case if she wants water in night, because she will wake up in the night at 2 or 3 and she'll have water. So I'm just monitoring her for everything, how she's doing. And is her snoring is going to be like getting better, or it's going to be worse. So I'm just going to monitor her for that. So maybe sleeping with your child would be good, because if you're sleeping with your child, you can monitor well that how they are doing and how they are sleeping throughout the night. And also you can do a sleep study. So some you know, doctors can um send send your hospital for sleep study, and some, I think some private practitioners also do like sleep study. They can come to your home and they can do the sleep study for you, or I think you can just go to the hospital and get a sleep study done. So I have not done any sleep study yet. I haven't scheduled for any sleep study because I spoke to the allergist and he said there's no point of doing sleep study. But if you have facilities to get a sleep study done, you can get a sleep study done. So again, before getting the adenoid surgery, these things you can definitely try. The allergist, your dentist, talk to your dentist about snoring, uh, how your child is sleeping at night. Your allergist, tell your allergist about your house, the environment you live in. Like, I live in woods and I have like a lot of deers, raccoon and everything. So let them know like what kind of environment you live in. And again, I threw like all the stuffed animals and like the soft toy and everything, because he said like, you know, just keep those stuffed toy away from your child. That's not good, because they are breathing in the with that stuffed toy, and it's not healthy. And humidifier, and keeping the air clean of your house, like get a air purifier or something. And what else? No and no dairy in night, and little bit of oiling in the ears and massage. And with the food, she does not have any food allergies, so she eat everything, because we did not test anything for the food allergies. So we don't know, but she eats everything. No dairy in the night, and nothing from freezer. So I do not give her anything cold. Like, I avoid ice cubes, like, you know, ice cubes in water. I avoid that. I generally give her like room temperature water, or there's something right from the filter. Nothing like very very cold. And I just avoid frozen stuff, like no popsicle, no ice creams, because, and I just bundle her up when she's going to school. I just make sure that she's all bundled up, she's wearing jacket, her ears are covered, because we live in harsh winters over here. So I just make sure that she's all bundled up. I think these are the things, I think, which you can do if you feel that your child is snoring. I think these are things you can do before surgery. So as a mother, I'm just sharing my experience, what I'm going through right now, what all I'm doing. And it is just a helpful video, which I think which will be helpful to you as well. Because sometimes when you go to a ENT, when they say, oh, let's get the surgery done, and you might be like, oh, is it okay or is it not okay to get a surgery done? And sometimes you just get the surgery done without looking for more options. And again, if you feel that surgery is necessary, you have to get the surgery done, just get it done. But again, if you feel that there are other options, you can look for more options, more things, like more options to help your child without having the surgery done, you should look for more options as well. So these are the things which I am doing, and this was all I wanted to share. So hope you guys like this video, whatever I'm sharing about my child. And this is, again, it is just my personal experience. And again, if I plan to if I go ahead with the surgery on in March end, I will update about the surgery also, how the surgery was, and the before surgery and after surgery. I'll try to update you with that also. But in the meantime, if your child is having snoring problem, if having difficulty sleeping in the night, I think dentist, going to an allergist, or maybe someone who is specializing with the airways, um, take an appointment with them and make an informed decision. Ask your friends, ask your colleagues what they are doing, because I think adenoids and ear tubes, uh, these are very common problem with the kids under 7 or 8 years, because when they go to school they get this strep virus, they get RSV virus. So there are so many things which is very, very common in everybody's child. And when you talk to other parents, you get to know what they are doing, and it can be a little bit helpful to you also. So maybe talking to more parents in your school group, like from your school, from the friends community, I think it will be helpful. So make an informed decision. And yes, if your kid needs a surgery, get the surgery done. And again, uh, uh, again this was all I wanted to share in this video. So have a good night, and thank you for watching. Bye.